be at the whole hour. So it
Thank
shouldn't be for the whole hour.
Thank you.
Fabulous. Right, we just got a couple of others just joining the call. Wonderful. I think if we get started now, Yava, are you happy with that? Yeah, wonderful. Okay, doke. So I'll just share my screen so everyone can see what we're up to.
Oh, hi. Good evening. Just one quick thing, please. I'm not registered, but my manager asked me to join anyway. So can I send you my email through her? So because I don't want to really put it on the chat. But my name is Siham Temasi. I'm from Smart Mental Health Service of Chelsea. But I will send my email through my manager. Is that fine?
Yeah, Eva, if you put something in the chat so that people who haven't registered know what to do. And
Thank you very much.
Move that forward.
I appreciate it. Thank you.
Fabulous. Well, just to introduce myself, everyone, my name's Emma Barry, and I'm the Programme Manager for the London Tobacco Alliance and Stop Smoking London. And just so that you guys are aware of what these two programs are, London Tobacco Alliance is the regional tobacco control program for London. So we're funded by all of the local authorities within London, and we're a sort of partnership organisation with the aim of raising the profile of smoking cessation and tobacco control issues across London. Stop Smoking London is much more of our sort of public facing arm of that. So that's where we will deliver our smoking cessation campaigns, signposts to our website, provide information and resources for smokers. So that's just to give you a little bit of an understanding of who I am and what sort of work that we do. But I'm going to be talking to you today about the impact of smoking and the principles of delivering what we call very brief advice on smoking. And that's something that within the roles that you guys will be doing as community champions will work very, very well for you in terms of sort of helping to support your community. So just to go over a few house rules. So if you haven't already registered for the session, please do so, mainly so that Yada can get your certificate sent out for you. If I can ask that everyone keeps their microphone off, just because some people can have background noise without realising, but obviously switch it back on if you need to ask a question. And I'm quite happy for people to ask questions as we go along, but there will be time for a Q&A at the end. But yes, please just sort of, when you're asking a question, just share your name and your borough that you're working in. It doesn't have to be your full name, you can just be, you know, I'm Jack from so-and-so. And just to give you a bit of an understanding of what the aims are of today's session. So, oh, sorry, I'm just going to move everyone's heads a little bit. So the aim is to sort of give you guys an understanding of the impact of smoking, so that you can understand what type of support is available for smokers, how your role of community champions can help in terms of signposting smokers, and understanding what the principles are of very brief advice. And very brief advice is something that's been developed through the National Centre for Smoking Cessation and Training. And this presentation has been developed using their materials and their resources on very brief advice. Fabulous. So I'm just going to minimize your heads. That's it. And then I can sort of see my screen properly. Fabulous. So what's going on with smoking in the UK? So just to get an idea of you guys' understanding of some of the background of this, just shout out, how old do you guys think you have to be to legally buy a packet of cigarettes in the UK?
18.
18? Yep. Any other comments?
Yeah, 18.
18.
Yeah.
18.
18.
Yeah, everyone seems to be sort of agreed on that, and you're quite right. It is 18 years. It used to be 16, but back in 2007, that's when it rose rose from 16 to 18. So, if you had to sort of guess, what age roughly do you think most smokers are when they start smoking? Again, just sort of shout out what you think.
16.
So we had 16 there. Any other ages?
10
years of age.
12.
So we've got 8, 10, 12. Any other ones? I mean, to be fair, you're all fairly, not quite usually as sort of low as that, but what we do know is that 80% of smokers will start before they turn 20. So most smokers will start at a very young age, but it becomes a lifelong addiction and a lifelong behaviour. But what we do know is that almost 3/4 of smokers have said that if they had that choice again, they'd never start smoking. And we know that most smokers want to quit smoking. So you're talking about an audience that is quite often motivated to quit, but doesn't necessarily know how or the best way of going about that. So what this graph is showing, I'm not going to sort of bore you with data and stats and things like that, but this is showing how the smoking prevalence in the UK has been declining quite steadily over the last 10 years or so. In fact, when stop smoking services were first introduced back in 2001, the prevalence in the UK was around about 27–30%. So nearly a third of all people in England were smoking. This year we're down to 11.6%, and we're very, very close to that, or very similar to that in London. So 11.7% of Londoners currently smoke. But what that means is there's still well over 800,000 people living in London that are smoking. So when you sort of round that up, we're not far off 1 million people in London still smoking. So there's still a lot of work to do in terms of helping people to quit. And how big of a problem is this? So we know that smoking kills 2 out of 3 of all long-term smokers. And recent data that was published in the new year shows that every cigarette takes 20 minutes away from your life. So on average, we know smokers will die around 10 years earlier than non-smokers. And if we look at the sort of impacts this has in the UK, if we all remember back to where we were 5 years ago, we were sort of coming up to that start of the pandemic. In 2020, 80,000 people died because of COVID. But in that same year, 94,000 people died because of tobacco-related illness. So it has a massive impact in the health of people in England and the UK. So why does smoking drive inequalities? So what we know is that the prevalence has been going down, but there's still very wide gaps between the rich and the poor in this. So if you're someone who works in a routine and manual occupation, you're nearly 3 times more likely to be a smoker than someone who works in a managerial or a professional occupation. If you live in social housing, you're 3 times more likely to be a smoker than a homeowner with a mortgage. And if you're someone without qualifications or any type of qualification in that area, you're 4 times more likely to be a smoker compared to someone who's got a degree or equivalent. And we also know that people who are living with long-term mental health conditions are twice as likely to be a smoker. So we know that smoking is more likely to be borne by people who are less financially able to afford it and usually have other issues or other inequalities that are affecting their lives as well. So what sort of impact does it have on the body? Well, we know that smoking is the leading cause of preventable illness and early death, not just in London, but in the UK. And the harm from tobacco is caused by the tar. So when you burn that tobacco, the tar that's in the tobacco leaves the cigarette, is vaporized in the tobacco smoke and sort of coats the inside of your lungs. So obviously that's the sort of brown bit on the tobacco filter. There's more than 5,000 chemicals, of which we know over 70 of them are carcinogenic. So when you look at things that might be in, you've got things like butane, that's like lighter fluid. You've got ammonia, which could be found in toilet cleaner. You've got industrial solvents in there. So there's so many different chemicals that are present in tobacco and tobacco, or present when you burn the tobacco as well. And one of the other most dangerous substances is carbon monoxide. Now, that's something you get from burning the tobacco. So we all know about carbon monoxide. It's a gas that you get from faulty boilers and car exhausts, but you get it from burning anything that's made of carbon. But if you think you're smoking a cigarette, you're essentially putting that carbon monoxide straight into your body. So it replaces the oxygen in your blood, which means you've got less oxygen going around your body, and it makes your blood more sticky, which means you're more likely to get clots and things like that if you're a long-term smoker. So they're the 3 main elements that cause the harm from tobacco. And tobacco also contains nicotine, which is very, very highly addictive. However, Nicotine itself is relatively harmless. It doesn't cause the harm. The harm from the tobacco is caused by everything else, but the nicotine is the bit of the cigarette that smokers are addicted to. And that's why it's very hard for people to give up smoking, because that nicotine is so addictive. So what parts of the body does smoking actually affect? Well, essentially, if you want a real simple answer, smoking affects your whole body. Smoking affects your blood, and your blood gets around to your whole body. But some of the things that it can do is increase the risk of high blood pressure, cardiovascular disease, and particularly because it affects your blood vessels, it can affect things like your eyes. So you're more likely to get things like cataracts or loss of sight, or something they call macular degeneration, which is a much higher risk if you're a smoker. You can have strokes. It can cause clots, which can cause a stroke in your brain. It affects your heart, so you can have heart attacks or poor circulation. Essentially, all over your body will have an impact from smoking. And what we also know is that if you smoke, you're 10 times more likely to develop cancer than someone who's never smoked. So it increases the risk of lots of different cancers, not just in the lungs, as most people would expect, but also in the mouth, the throat. The bladder is one that people don't always expect, but there's smoking is shown to have a risk and increases the risk of bladder cancer as well. So there's a huge amount of impact that it can have on your body. And what we know is that 60% of all ill health from smoking is caused by 4 major diseases. So COPD, which is chronic obstructive pulmonary disease. That's basically things like emphysema, chronic bronchitis. They're the people that you will find that they struggle to breathe, or just find it much harder to do everyday activities because their breathing is so restricted. Coronary heart disease, that's things like clots and strokes and heart disease. Lung cancer, and stroke is one of the main 4. So they're the sort of 4 major illnesses that are primarily affected by smoking. But the good thing is, massive changes happen to your body when you give up smoking. So within the first few days, your oxygen levels start to increase. Your carbon monoxide levels very, very quickly return to that of a non-smoker. So within about 24, 48 hours, you get the level of carbon monoxide that someone who's never smoked will have. After a few days, your sense of taste and smell will start to return. So a lot of smokers find that they don't always realize it's happened, but their sense of taste and smell has been dulled through years of smoking. But actually, they find that they start to enjoy their food better and can smell things more clearly. So your blood circulation starts to improve, and very quickly your blood pressure starts to reduce. And then obviously, as you've not put any nicotine into your system for a few days, that starts to flush through your system. So unless you're doing something to sort of manage that, some people do find that they start to get nicotine withdrawal symptoms, which can lead to urges to smoke. Within a few months, people find that their lungs start to heal, so they're breathing better. They've got less shortness of breath. They find it easier to exercise or just to move about. And not just that, people find that they're saving lots of money as well by quitting. And after a year, most people will really start to find that their breathing and wheezing has massively improved, and that their risk of heart disease has reduced by 50%. And those benefits continue to build on year. So the longer you continue to be smoke-free, the better your health will be, and the less risk of long-term disease you'll have. And if you've already developed a long-term condition based on smoking, a lot of people find that's easier and reduces the risk of serious impact. And people will also find that they'll develop less likely to develop things like type 2 diabetes, osteoporosis, dementia, and eye disease, all of which have higher risk if you are a smoker. And we know that smoking is very, very expensive. We've actually got a calculator on our website where smokers can put in how much they're smoking a day. and say whether they're smoking cigarettes or roll-ups, and it can show them how much money they can save in a week or a month or a year. And if a 20-a-day smoker will save over £5,000 a year by quitting smoking. So there's a huge benefit that people can get financially by quitting smoking. And it may be that they're saving up for something positive like a holiday, or put towards sort of, you know, a new car or something like that. Or it could just be, do you know what? I've got more money at the end of the week in my wallet or my purse, and I haven't got to stress if those those unexpected bills crop up, because they've got that additional money to manage that. So it really can benefit financially. So I've talked about some of the impact that smoking can have, but what support is there for people who are looking to quit smoking? So firstly, we know that it's not easy giving up smoking, and a lot of smokers will have multiple attempts before they finally succeed. But we do know that smokers are 3 times more likely to quit smoking if they get help and support and they use stop smoking aids. And we know that many people try to quit smoking and might be smoke free for a period of time and then relapse for various reasons. But we encourage all smokers that if that's happened, use what's worked previously, build on that for your next attempt, and you might find that it helps you to avoid a slip up next time. But the important message is never to quit quitting. You will always be able to make it that little bit further, and next time might be the time that you quit for good. So most local authority services, well, all local authorities will commission stop smoking services, and the service that is commissioned will depend on where you live. So different boroughs will commission their services slightly differently. Some will commission a specialist service, so that's a team of dedicated stop smoking advisors, and that's their job day in, day out, to hold stop smoking clinics and support smokers across their borough. Some local authorities will also train up either nurses or healthcare assistants in GP practices, and they might be able to deliver a smoking cessation service within your GP practice. And quite a lot of areas will also train up pharmacy staff to deliver stop smoking cessation services. So it will be slightly different in all of those different areas, but our Stop Smoking London website provides lots of information, and most importantly, signposting information to those different services in the different boroughs. But our website also has lots of guidance and information for smokers. And at the moment, we've got a smoke-free app for London that people can sign up with to get stop smoking support over the on their phone through an app, or they can sign up to our text message service as well. And there's also a lot of stop smoking services now being delivered in NHS hospitals. So anyone who is admitted as a patient overnight, so if you're an inpatient, you'll be offered smoking cessation support while you're in hospital. Anyone who's going through the maternity services and is a smoker will be offered support. And many of those maternity services will also extend that to support to significant others and household members that smoke as well. And if anyone is interacting with the mental health service, particularly if they're an inpatient, they will also be offered smoking cessation support as well. And that type of support, as I say, will vary, but in most cases, it will offer behavioural support. Now, this is advice, counselling, and ways to make it easier for the smoker to stop smoking. They'll give them information about smoking, tell them tips and advice on how to stop, go over different treatments and medication, and they can be delivered in sort of one-to-one sessions, or sometimes they're delivered in group sessions as well, and there's quite a lot of success that happens in group sessions. But as I said earlier, what we know is that smokers are 3 times more likely when they combine, when they use behavioural support, and also combine that with stop smoking treatments. So what can a smoker expect from behavioural support? And in your role as a community champion, please don't worry. I wouldn't be expecting you guys to deliver this type of behavioural support, but maybe just sort of have an idea of what might happen in case that comes up in conversation with people when you are signposting them to support. So They're trained and accredited teams of advisors, and they provide friendly, but most importantly, non-judgmental support. And depending on the area, that support can range from 6 to 12 weeks. They help the smoker to set their quit day, which is their first day of not smoking. But they'll talk about their smoking history. They'll talk about their day. They'll talk about their sort of patterns and behaviours and try and find out what that individual person's different triggers and reasons for smoking are, and then help them find ways to sort of change those routines or manage those triggers in different ways. They'll also go through medication options so that they've got something that helps to relieve the cravings and then relieve the withdrawal symptoms from them. A lot of those services will deliver that support over the phone now, which has been increasing in popularity since COVID. But if they're being seen in person, they'll get them to measure their carbon monoxide levels. And I used to be a stop smoking advisor, and a lot of my smokers used to really enjoy doing that because they would see how quickly their smoking levels would come down. Their carbon monoxide levels will come down. So like when people do things like Weight Watchers and things, and they go on the scales and see how much weight they've lost, it can be quite a motivator for people to see that progress. And this is a really good visual way for smokers to see their progress. They have regular follow-up sessions. So quite often in the early stages, that might be weekly, but it might, and then sort of shift to sort of fortnightly after that. But it gives them support to help them to understand and manage those difficult moments that they might come along during their quitting program, and they help to motivate them along the journey. And that's why this behavioural support is really impactful at increasing the rates of people quitting smoking when people use it. So they'll all usually combine that with some sort of stop smoking aid. So as I say, I'm not expecting you to sort of know these in detail, but just sort of for your information. First type of stop smoking aid is nicotine replacement therapy. So that's things like your patches, but you've also got gums, you've got lozenges, they've got mouth sprays, and they all deliver the same nicotine. They give you the nicotine that they would have got from their cigarettes, but they deliver it in slightly different ways, and that helps them to manage those cravings and manage those withdrawal symptoms, so that it makes it a bit easier on their body, because their body's getting the nicotine that they've been addicted to, but they're getting it without all the harmful components of the cigarette. So it's a much safer way of getting that nicotine. And then over the course of their program, they slowly reduce that. So they're getting used to less and less nicotine. And then by the end of their program, they're usually on little or no nicotine at all. Another treatment option is prescribed tablets that you can take. So these work in different ways. So they don't contain nicotine. What they do is they reduce the urge to smoke and relieve some of those withdrawal symptoms, but they also make the cigarettes less enjoyable. So when people smoke and they're taking these tablets, people find that the cigarettes start to taste unpleasant, or it might make them feel a bit nauseous. So it puts them off of smoking. But at the same time, it's reducing those cravings and reducing those withdrawal symptoms as well. And quite often now, they will now provide e-cigarettes, or we call them nicotine vapes, to help people to quit smoking. So these are slightly different. So they still provide the nicotine, but instead of providing it as a smoke, they're producing a vapor which the smoker would then inhale, but they don't produce the harmful carbon monoxide and tar, and they don't have the same level of chemicals that would be present in tobacco smoke. So we know now that they're a very safe and effective aid for smokers to quit smoking. In fact, they're the most common treatment option for a lot of smokers now, and very, very successful. All of these products are available through smoking cessation services. Prescribed medications obviously need to be made available through GP practices, but a lot of pharmacists can also provide the prescribed medication as well. And whether you're using any of these products, the Stop Smoking team will always encourage smokers to look at their routines so that they can sort of make tweaks and changes to help avoid some of those triggers. And that's where that behavioural support helps them. So what is very brief advice on smoking? So I've talked to you today about the impact smoking has. So we know it's the leading cause of preventable ill health and early death. We know it drives inequalities in the population. And we know that it has a significant impact on healthcare demand with smokers accessing NHS services. So how can very brief advice help? Well, it helps to prevent patients from developing future conditions. So if you can get someone to quit, if someone can stop smoking, their chances of developing cardiovascular disease or COPD, for example, or lung cancer are reduced. So their chances of developing those are going to be much reduced, which means in the long term, their demand on healthcare services is going to reduce as well. If they've already got established disease, it helps to improve those outcomes and means they're less likely to have severe impact from those. And in the long term, we know it can save lives. As I said earlier, 2 out of 3 long-term smokers will die because of their smoking. So helping someone to quit in the long term will help to save lives. And what in your role helps as community champions, you've got a very unique opportunity. You spend a lot of time with the local community, so you get to speak to them on a day-to-day basis, and you act as a sort of source of information and guidance about what's happening locally and how to signpost them to support. Through the different programs that you'll sort of link in with and other services, you'll get experience about understanding those different community services. So when you're talking to someone about one community service, the topic of smoking might come up and you'll be able to sort of link that in. So you do act as sort of trusted voices within your community. So people will listen to you. And if you encourage someone to take up that opportunity, they're likely to listen to you. And it fits in with something that we call Make Every Contact Count, which is a public health initiative, which helps to utilise a lot of these sort of teachable moments and encourages people to refer people to get support for a lot of these modifiable risk factors like smoking. So I'm going to talk to you about very brief advice. It doesn't need to take a long time. It can be done in 30 seconds and it should be considered standard practice. I'll say I use this slide with sort of healthcare professionals as well. Obviously, you deliver it when it's appropriate, but it can easily be covered in 30 seconds. And most conversations, you can find a link with someone to sort of highlight the importance of signposting them to support. So I've talked about it. What is very brief advice? So essentially, it's simple advice. It's designed to be delivered opportunistically. It can be used in any situation with a smoker and delivered as little as 30 seconds. It's not a smoking cessation consultation. It's not advising smokers how to stop. So you don't have to talk to them about the different products unless you sort of have a bit more understanding. You don't even have to ask them how much they smoke, and you don't have to ask them if they want to give up. But the evidence around very brief advice is that just advising someone that support is available and signposting them where they can get that support will encourage people to take up that offer of support. So we know it's cost effective and it's proven to be effective at helping people to quit smoking. As I say, it can be delivered opportunistically and it comprises of 3 components. So the first component is to establish if they're a smoker. So in your conversations sort of out in the street or the public, you may be able to smell that they're a smoker. They may be smoking while they're talking to you, or it might come up as part of that conversation. But we know that smokers, they expect to be asked about their smoking, especially when people are talking about their health or linking that conversation into their health. So the first part of VBA is to ask, find out if they actually are a smoker. To say you don't have to ask if they want to quit smoking, just advise them on the best way to stop. Did you know that actually it's you're 3 times more likely to quit smoking if you use support and stop smoking medications, and then offer them help by signposting them to support, or better yet, if you've got the facilities and the pathways to do it, make an actual referral. And that's the third component. So the 3 components are ask, advise, and act. And there's a really good sort of summary screen. I'll sort of share that with you later. And this is how the National Centre for Smoking Cessation training sort of lays out that those 3 components. So ask, find out if they're actually a smoker. Don't miss the opportunity to deliver very brief advice by assuming that they don't smoke. And as I say, people expect to be asked about their smoking. So don't be afraid to sort of find out if they're actually a smoker. When it comes to advising them, you might need to sort of find, you know, obviously you're not having sort of full healthcare conversations, but maybe sort of find out the sort of hook that relates to that person you're seeing. You may be talking, they may be talking to you about, you know, I've been having sort of health problems lately, and you might be doing a sort of public health awareness program in your area. Find that sort of hook that they're that links in with that conversation you're having with them. Or they may be sort of talking about finance problems. You might be there sort of supporting a sort of financial or sort of cost of living sort of initiative in your borough, and we know that sort of the impact that smoking can have on their finances. So it may just be sort of linking in and finding that hook that they have. And then just follow on, just say that their best chances of stopping smoking is with a combination of specialist support and medication. And that London has got excellent services across every borough. And then that we've helped and saved thousands of smokers from stopping smoking. And this would then be your opportunity to act. So if they're interested, signpost them to stopsmokinglondon.com, where they can find their local stop smoking service. Or, as I certainly would encourage you guys to do, find out your local stop smoking service details and direct them to their local stop smoking service. And if they're not interested, just acknowledge them as that's their choice. Give them the information for the website and just say, look, there's information there if you ever change your mind. But just let them know that that information is there and they've got that available for them. And what is there on the Stop Smoking London website? So they've got a really easy drop down so that they can find their local borough, and then that will take them to the page of their borough, which highlights the information there and all of the contact details. We've got lots of other information and pages that support, give them information about why it's important to quit, information that links smoking to different problems or different healthcare issues. We've got our stop smoking calculator, and we've got lots of pages there with different different tailored support. So there's loads of information they can find on the Stop Smoking London website, and they could also sign up to get daily text messages that are tailored to different reasons for quitting as well. There's also lots of guides on there. So we've got guides around understanding the myths and misconceptions around vaping. We've got guides on the link between smoking and cardiovascular health, smoking and dementia, for example. So there's loads of different guides on there. And we've also got lots of success stories on there from different smokers across London who've successfully quit smoking, who share their story. We've got downloadable guides and practical guides helping people to quit smoking, as well as a hints and tips one-pager. And we're always bringing out new resources. For example, we recently introduced a downloadable calendar that people can print off and put on their fridge and mark their smoke-free days on there. So there's loads of information on there as well. Now, what I am also going to just very quickly touch on before we come to the end is just a little bit about vaping, because I know it comes up and I know people have a lot of questions and concerns around vaping. So I'm going to talk about vaping for adults who want to quit smoking. So we get lots of sort of scary noises and scary words when we think about vaping. So we hear things like popcorn lung, it's unproven, people get hospitalized, they're dangerous, they're more addictive than smoking. And the truth is that's not accurate. So vaping is essentially an electronic device that's a sort of battery in there, and it heats a coil that heats up an e-liquid, and that e-liquid contains nicotine, flavors, and something like propylene glycol, vegetable glycerin, which is essentially very similar to what you get from the vapor that's produced in smoke machines in clubs and things like that. So it produces a vapor, so it's not a smoke, it's a vapor, and the user sort of inhales that, and that's how they get the nicotine. But what we know is it doesn't contain carbon monoxide, so they won't get carbon monoxide from that. It doesn't contain any of the tar, and it doesn't contain anywhere near the same amount of chemicals that you get from that you would get from a traditional cigarette, and that's why they're a very, very common choice. But the government wanted to sort of look at this in detail, so it produced its nicotine vaping evidence review a couple of years ago, and it pulled together a huge amount of studies and research on vaping. And that's the thing, people think there's not a lot of data out there. There's a huge amount of data out there. So there's, you know, lots of information that was sort of pulled into this, and it highlighted that vaping, while it's not entirely risk-free, it is a fraction of the risk of continuing to smoke. So it's significantly less harmful than smoking. Doesn't appear to cause any serious unwanted effects, especially in the short and medium term. And they did recognise that we need a little bit more long-term data, but even then they recognise that actually what they know from the components of the vapor and the e-liquid, it's unlikely to cause long-term effects. Carbon monoxide levels are significantly lower when people use vapes, and therefore they recommended it as a treatment choice for treating smokers to quit smoking. And it's also recommended as an equal first-line treatment by something called NICE, which is what provides a lot of the clinical guidance for medical staff. So that's another piece of guidance that's also recommended vaping as an equal first-line choice. And there's lots of myths about it, and people think, oh, it's just as harmful as cigarettes. Can you get secondhand vapor from e-cigarettes like you do secondhand smoke? Does it cause popcorn lung? Can vapes explode? Things like that. And the simple answer to this is no, not really. There's a huge amount of myths around vaping, and we've got some good explainers. We've got a guide on explaining the myths around vaping. We've got Dr. Iram Patel. She's the co-clinical director of the London Respiratory Network. She's a respiratory consultant that works at King's Hospital. She talks to you about what popcorn lung actually is and how you can't get that from vaping. And you know, vapes aren't going to explode. If you buy, you know, you like any other, they're at no higher risk of fires and things like that than any other electrical device. So they're at no higher risk of that than any other electrical product. And we all remember Chris Whitty. He's the Chief Medical Officer from England. And back during the COVID days, he was one of the ones standing up on the platform, talking to the public about it. And his words on vaping are, if you smoke, vaping is much safer. If you don't smoke, then don't vape. And marketing of vapes to children is utterly unacceptable. And that's the difference between vaping for an adult as a smoking adult looking to quit. It's a much safer option. For young people, it's a very, very different message, and we don't want young people and non-smokers to start vaping because it isn't entirely risk-free. So what are the next steps that I'd like you guys to do? Well, I've talked to you a little bit about very brief advice, but there's a fantastic video, literally only takes about 30 minutes, available on the NCSCT website. It's free to access. You just get a little sort of short assessment at the end, but you get a certificate that you can use, you know, if you do sort of CPD points, or you know, you want to use it for development or anything. And then download the memory jog, which is basically that that sort of one page around ask, advise and act, and that can be downloaded on there. But what I do encourage you guys to do is make contact with your local stop smoking service. Use our signposting guide on the website, or speak to your community champion coordinator in your borough to make contact with the team. Find out if they've got a direct number that you can refer people to. Find out about where local groups or communities are holding stop smoking clinics in their borough, and find out if there's any communities that the Stop Smoking Service particularly want to target in your borough that you might be accessing for other initiatives that you're working with. So that's what I would encourage you to do if you do get that opportunity. Speak to your local team and find out how you can help them. And I don't know if we've got time, but I just got a very, very short video. It's literally only about a minute. It's just from some of our partners in. Actually, do you know what? I'm not sure I clicked share with sound. So, Eva, can you just shout out if you can't hear this? If not, I won't worry. It does. You won't hear anything straight away.
Still no sound.
Upset, the first thing I would do was reach for a cigarette. I went to a smoking clinic. The young lady there, Christina, was ever so helpful.
Can you guys hear that?
I realized that my breathing wasn't as it used to be. When I didn't really decide to give up smoking, because my breathing was getting more worse, and they said it's the cigarette doing it.
Well, it felt like I had the stub of a rolled cigarette behind my ear virtually all the time. You did get some little quick wins, but the longer term wins as well, like you had more money in your pocket, you felt better, you didn't get out of breath, and you didn't get those horrid sore throats. To anybody who's looking to stop smoking, don't stop trying to give up. You can and you will do it in the end. Believe yourself.
Well, if I give any advice to anyone who want to give up smoking or stop smoking, all you can do is try.
I actually feel very, very good. I can walk, I go through Brockwell Park, I can smell the flowers. I really feel, since I've stopped smoking, that I have a better life. And I'll celebrate my 80th birthday without a cigarette. How about that?
And I think that's it. So I'll stop sharing my screen. Did that? I couldn't tell. No one said that they couldn't hear anything. So hopefully that sound was playing properly for you. But yeah, any questions or anything anyone wanted to ask at all? So I've just seen the chat. Yeah, Joe, that is Chris Kennedy, who's the counsellor for health and adult social care in Hackney. So yeah, it's good to see him part of that. So no questions at all?
Yeah, I've got a question.
Oh, yeah.
Thanks very much for that. That was really interesting and helpful. I live in Southwark and I'm actually an ex-smoker. I stopped because Southwark was offering its residents free treatment at the Alan Carr clinic, and I'm just wondering why that's not mentioned in your presentation, and if that's something that other boroughs might be doing, if you know about that.
So the Alan Carr, I know that Southwark were one of the boroughs that took up Alan Carr. There's still limited data on that, so we don't have as much information. So it's not on offer in most areas. So that's why I've not really mentioned it. The National Centre for Smoking Cessation Training recommends behavioural support with the treatment aids. So it's better, it's Alan Carr does work, and obviously it's clearly worked for yourself, but there's still limited data behind that. So that's why a lot of services are waiting before they offer that. So I didn't want to start bringing in additional things that most areas aren't offering.
Well, just so everyone else knows, if you are in Southwark, it is available still in Southwark. And as a lifelong smoker who's been stopped now for a year, I highly recommend it.
Yeah, and it's there's a lot more data starting to come through, but I didn't want to sort of raise that until most areas have got that available for people.
Yeah. Thank you anyway.
That's okay.
Emma, as Shireen, I work for Zala Health Weight Management Program. They're also doing stop smoking, and they offer like vapes and different methods like chewing gums and stuff. And they have clinics where they get support from, like the smokers will get support from. So I don't know if we could do some more training to become one of the facilitator for stop smoking, if that's a possibility. Maybe we'll have to do a bit more intense training. I did do training with Zala to become a facilitator, but then again, when you've not got that experience on what you should be prescribing, I didn't feel confident in delivering, because even though I did the 2 days training full on, but I don't feel that confident, because what are you supposed to give them and how are you supposed to give it? And like it's like sometimes they get this withdrawal symptoms. It could be like affecting their mental health. And also I do relaxation and chair yoga, laughter yoga, all that kind of stuff. So I left my number in the chat. If you can call me, then maybe something else can help with the stop smoking, like healthy exercises, and get their mind diverted into doing something else.
So to be a stop smoking advisor, you have to do the National Centre for Smoking Cessation Advisors Practitioner Training. So that's available through the National Centre for Smoking Cessation training website. But most local authorities will own. So when they're so who's commissioning Xyla Health? Which borough is doing that?
In London Borough of Newham.
Newham. So they have a slightly different so in Newham, their stop smoking services are delivered by Queen Mary in Westfield. So they've got a massive stop smoking service. So they probably won't be looking at embedding smoking services in the other commission services that they're doing. But speak to them if that's something that you want to do a little bit more about. They may be able to sort of give you a little bit of direction. But most local authorities will insist that you've got well, they should insist that you've got the NCSCT practitioner training, but they will also encourage you to do, and it can be delivered either 1 day or 2 day practitioner training in-house with the stop smoking services, and different services will arrange that differently.
And then we can get some paid work. Is that possible?
Again, different services commission that differently. I'm not delivering any of those services. So
today we're going to get a certificate for attending, just a general one, isn't it?
This is just about very brief advice. So this is just essentially it's helping to signpost or make a referral for people to quit smoking. This is not about treating people to quit yourselves.
Yeah, I think you've done an amazing job, and I think that you've highlighted that the very importance by stop smoking, how it can prevent serious illnesses and how people can get benefit from it. And I think that's very useful, because I work in the community, I work for the NHS, I work for the local authorities. I think it's very important that if by giving 30 seconds of your time and helping somebody could save their life.
Exactly, and that's the thing. It's just you spending 30 seconds just to have a chat with them and just say, actually, this support is there. And we know that lots and lots of smokers, it takes a long time for them to have that sort of motivation, say, do you know what, I'm going to do it, I'm going to quit smoking. But a lot of smokers who want to quit don't know what support is there. So even if you deliver very brief advice to someone multiple times, it's like drip feeding that information. When they're ready to hear it, know it that it helps to sort of activate that next step along the journey for them.
And it's also like the local temples, the churches, the mosques, where people go to pray, where people meet. That's where we can target and give them that, 30 seconds. And even women, like they might be covered in hijab or scarf, but they still smoke. So, like we can help everybody. So I feel children as well, schools. I don't.
So that's why I suggest, speak to your local team, find out if there's any communities they particularly wish to target, and then obviously as community champions, you can link in the work that you guys are doing, and if those opportunities come up, you've sort of already had that conversation, and you're targeting a community that they're particularly looking at.
Just like to say thank you so much, and I'm going to put my email address in there. If there's other courses like this, please keep me and my friend Arti in the loop.
Thank you.
Thank you.
Is there any other questions at all, or anything that anyone wanted to ask at all? No. No. Well, if you're happy, Ava, I'm quite happy to leave that there. Brilliant. Well, look, thank you everyone for joining us today, and it's been really good to see so many of you on the call. I'll share some. I'll make sure you've got a copy of these slides to go with as well. But I'll also get Ava to share some links. I'll send her some links that you can just sort of keep on, just keep in the back of your head, and have a little look on our website. You might find there's some really good pages that you just want to say, do you know what, I'm going to keep that page in mind, and if I'm talking to someone, I'm going to send them to that page and have a little look. So just have a little play on the website yourselves and have a little look through, but I'll send those links.
Just like to say thank you.
Thank you very much. Cheers.
Bye.
Something ain't right here, right? Because even if she did do it, what's she waiting now to confess? Well, yeah, but